audience, wonderful audience. Both of you all know me, and President of the Westchester. We are put together to see that one. Primarily, it's going to be benefit to our audience and Indian patients. As we all know, the prevalence of diabetes is increasing tremendously among Indians, Southeast Asians, East Asians, particularly Chinese and Indians. Why it is so common? All the speakers spoke about this, why we are so vulnerable to have the diabetes. Type 2 diabetes is very common among Indians. Why I want to see that one? Most of the diabetes patients are treated by the primary care physicians. I know only about 10 or 15% of my patients will refer to the specialist. But we have to have to have understanding of how we can, as a primary care physician, we can treat the diabetes mellitus. Very important. So now we told you so many types of diabetes, type 1, type 2, and secondary type of diabetes, only important. Treating only diabetes is not very important. 1/3 of all the patients of diabetes will have high blood pressure. 1/3 of all diabetic patients have hyperlipidemia. 1/3 of all patients will have other secondary problems with diabetes. So we are not focusing only on diabetes. We have to focus other things. My own introduction is to say, to make sure that when I have 3 Ds, what is 3 Ds means? Diet, diabetes and death. If you prevent diet, if you take control of the diet, you will control diabetes. If you control the diabetes, you prevent the death. So how 3 Ds are important? This is a message to take home today for all of you. Indians are more prone to have diabetes as such. So what I want to say as a primary care physician, you have to recognize who has diabetes or not. What are the important things? Patients those who are developing diabetes will have going to bathroom quite frequently. They feel very thirsty. They feel blurring of vision. Some of them have repeated urinary infections. Some of them have repeated skin infections. Women may have a lot of genital infections. That is an important thing to remember. The patient is developing diabetes. Do not take any chances, particularly those who have diabetic patients or those who have family members who have diabetes in the family. That's very important to take immediate advice to go to your primary care physicians, get it checked. Whether it is true or not, it's very essential to diagnose patients. As in the United States, till now, there are about 20 to 23 million populations of diabetes are particularly rising. Among diabetes are number 1 cause is Chinese and Indians. Highly rise the number of diabetes, new diabetes diagnosed in these countries are Chinese and Indians, very important. As obesity is one of the common cause for the diabetes type 2, but Indians, only 30% of Indians are obesity. That is a collection of the central obesity, that is fat. It's a collection in the belly, not in the abdominal wall. In the belly, the fat accumulation causes the insulin insensitivity. Patient secreting insulin enough, but it's not going into all the metabolism. Glucose has to take place in the muscle cells, and adipose tissue means fatty cells. The insulin is not pushing the sugar into these things because of insulin insensitivity. That is due to the obesity is very common among Indians. And the genetic factors, if the family members are diabetic, obviously most of you have to develop a diabetic, it's important. So if you're having the problems now, as we have discussed, my brother told me, going to South India, eat more rice, go to the Gujarat or the North Indians who are eating more sweet, other parts of the country. But other thing is that we are lacking, other things are all lack of exercise. We are not exercising enough to make sure that not only we are eating, we have to balance intake and output. In calorie intake and calorie output, if you are sufficient to be doing exercise 3 times a week, 1 hour or 3 hours a week, according to American College of Physicians, 3 hours a week exercise is enough for you to. No matter what you eat anything you want to eat, but eat a limited calories of diet what you want to eat. A diabetic, we can say don't eat any sweets. Yes, you can eat a sweet, a little bit of it, but everything has to be consumed appropriately in an orderly fashion initially. Another thing is that just having treating medication is not enough. We have to control the blood sugar, blood pressure, cholesterol. You cut down the smoking, cut down drinking a lot of alcohol. So diabetes, hyperlipidemia, high blood pressure, smoking, alcoholism, all considered as Angela equivalent, means they are like type of a heart disease. So in order to prevent, we cannot focus only on diabetes. We have to focus all the things to make sure that we are taking care of blood pressure, we are taking care of cholesterol, we are taking care of the blood, other aspects of the other health conditions, whatever you have. We have to deal with all the things. So important is that one. Diabetes is a silent killer, but it is a treatable disease, and you make sure that not only taking the medication that is important, blood pressure, blood sugar has to be controlled, blood pressure has to be controlled, and the cholesterol has to be controlled, and you have to go to your doctors regularly and make sure that your sugar is controlled according to the diabetic guidelines what we have established. And A1C level has to be checked every 3 to 4 months to make sure that it lies between 6 and 7, that's the maximum. And if you are taking, in addition to that one, not only taking one medication is enough, you have to take ultimate goal is to make sure that A1C level is very well controlled, blood sugar is all the time is controlled, high blood pressure is controlled, and cholesterol is controlled. So most of the speakers have already given enough about the diabetes mellitus, how we can treat, and I don't want to go into details. Only thing is we are going to take questions later, and I thank you for giving me, especially Sangeeta, to give me a chance to talk. Thank you very much.